Welcome back to Dr. Moses' YouTube channel. And on today's episode, let's look at the 11 things or symptoms that you should go to the ER but not the urgent care. I just came from the ER. I was on call last night and I saw some cases that triggered me to do this video to share this information with you. So there are certain things and conditions that you do not want to go to the urgent care. You waste your time, but you should be to the ER, you should go to the ER or call 911 right away. Let's dive into it. The first condition, if you have a deep cut or a burn on your head, your chest wall, your abdominal wall, your face, you should not go to the urgent care. You should go to the ER. If you have a burn and the burn is on your chest wall, your abdomen, your face, your head, you should rush to the ER immediately. The second one, if you have a bleed that you cannot stop, bleeding, you can't stop the bleed. It could be a cut, bleeding from your nose. It could be just vomiting blood. You could just be just going to the toilet and you have blood in it, or you're even urinating blood, or you have vaginal bleeding. You can just stop the bleeding. Do not go to an urgent care. Go to the ER, because what's going to happen is this. You end up having what we call hemorrhagic shock, and that can be very deadly to you. The next one, if you have a head injury and you have loss of consciousness, you are vomiting, you have nausea, you are disoriented, you should go to the ER, because you could have a concussion or you could have a bleed in your brain. The next one is chest pain. If you have chest pain of any form, don't toughen it out. Go to the ER immediately, because you could be having a heart attack, you could have a blood clot in your lungs, or you could be having what we call a dissection. That is the ripping apart of the big artery that goes through your heart. It's called the aorta. You could be having that. So you should go to the ER and don't go to the urgent care immediately. The next one is if you're having palpitations, all right, palpitation, and you can feel your pulse that is irregular, or you can just hear your heart beating very, very fast, and you may have even lightheadedness. Don't go to the urgent care, go to the ER, because you could be having a very serious arrhythmia that can be very, very dangerous to your health. All right, the next one that you don't want to ignore is difficulty breathing. All of a sudden, you just can't catch your breath, you can't breathe, or when you take a deep breath, it hurts your chest. If you're experiencing any of these symptoms, you may be having a very serious condition. You could have a blood clot in your lungs, or you could have what we call pneumothorax, where there's an air trapped in between your lungs, and that can be very, very serious, and you want to go to the ER immediately. The next one is you have abdominal pain of any form, most of the time, not just a generalized cramp, but a pain that is maybe on the right side of your abdomen, under your rib cage, the left side, the lower part of your abdomen, left or right. You could have in different conditions that can be very, very serious. So you could have like a gallbladder, you could have a spleen that is ruptured, you could have an appendix, you could have a diverticulitis. So if you have any of these symptoms, you want to go to the ER immediately. Don't go to the urgent care. The next one that you should pay attention to, if you have black stool, you go to the toilet and your stool is very dark, you woke up, you have several of those, you are bleeding from the upper GI, and so you want to go to the ER, because if you don't go, you're going to bleed a lot and you could end up having what we call hemorrhagic shock, and that will require you to call the ambulance. The next one that you should pay attention to, any symptoms of a stroke. You have a slurred speech, or you have blurry visions, or you lost a vision in one eye, or your arms are weak, you have a tingling and numbness on one part of your body, or you're feeling very lightheaded, dizziness, everything is spinning around with vomiting, that could be a sign of a stroke. You should call 911 immediately and get to the ER, because the sooner you get there, the faster we can intervene, because we have a window of about 4.5 hours. If you're able to get in there early and you're having a stroke, we can intervene and save your life. The next one is if you have a high speed accident, an impact that was very high speed, you could have a lot of fracture or internal bleeding. And so even if you don't feel anything, you could have an internal bleeding in your chest or in your abdomen. And so you want to go in immediately. The next one is if you overdose on medication unintentionally, maybe your blood pressure medicine, your blood sugar medicine, or any other medication you're taking unintentionally, you took several of them, you want to go to the ER because interaction of those medications can be very deadly to you and harm your body. The next one is you have any allergic reaction. All of a sudden, you ate something or you took a medication and you can't breathe, you have tightness in your chest, you are wheezing, or you're swelling of your lips, you should rush to the ER immediately because going there timely, giving some epinephrine can save your life. So these are some of the things that I've seen in practice that people go to urgent care, and by the time they come to the ER, it's too late or we have to struggle to save their life. So if you're having any of these symptoms, I want you to go to the ER. Now, if this information has been helpful to you, I want you to give me a like and then share this video with other friends so people can pay attention to any of these symptoms and signs. Otherwise, until then, subscribe to the channel and I say you stay well.